Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. In today's session, we are going to deal with a very important as well as a very easy topic, that is the functions of a nurse. So as a nurse, you have various functions to perform in the hospital setting. Now, before we move on to this topic, let us first see what is the definition of nursing. So, according to Henderson, nursing is defined as a unique function of a nurse to assist the individual, sick or well, in the performance of those activities which he or she would do unaided if he had the necessary strength, will, or knowledge. So, here, a nursing is a unique function whereby we will be assisting the client and we will be providing care to the client as well as the family members when he or she is not well. We will also be assisting them in their various day-to-day activities that he would himself do if he had the necessary strength, will, or knowledge. Here, being a nurse, there are various functions that you must perform. It can be as a caregiver, communicator, teacher, client advocate, clinical and ethical decision maker, counselor, change agent, leader, manager, as well as a research consumer. So being a nurse, there are different functions that you must perform when you are in the hospital or in the clinical settings. So now let's look at each one of it in detail. When any ill or injured person comes to the clinical setting, it is our responsibility to provide care. Not only is it sufficient that we will be providing care, but we must also assist them in various physiological as well as the psychological activities while preserving the client's dignity. So here, when an ill or injured person comes to the hospital, yes, we must be the ones who will be providing care to them, but not only that, we will also be assisting them in their day-to-day life activities, keeping in mind their dignity. A caregiver also encompasses the physical, psychosocial, developmental, cultural, as well as the spiritual level. So, as a caregiver, you will be the one who will be nurturing the client, providing care to the client, as well as creating a friendly environment so that the patient can be comfortable and will open up themselves. A nurse will also showcase some mothering actions where the nurse will be the one who will be assisting the client. Maybe if it's a person who is suffering from any chronic illness and who will not have the sufficient energy or stamina to perform their day-to-day activities, as a nurse, she will be the one who will be assisting them from, let's say, brushing, bathing, and providing medications and so on and so forth. As I've said, that she is the person who will be responsible for providing the direct care. As a nurse, you must also make sure that you build a good rapport and you create a friendly environment so that the patient as well as the family members becomes comfortable. So as a nurse, whatever activities we are performing for the client as well as the family members, we should involve both the knowledge as well as sensitivity in order to help them promote their health, and also in order to make sure that we are only doing what is important for the client. We as a caregiver must also show concern for the client welfare, and we must also accept the client as a person and not as a diagnosis. The next one is the communicator. As we all know that communication is very important, especially in the healthcare team. So here, nurses will always be involved in every multidisciplinary team, and also communication is an integral part of all the nursing roles. So as a nurse, she needs to communicate with the client, with the other healthcare professionals, with the support groups, with the family members, as well as the people in the community. So for this, it is very important that the nurse must develop a good communication skill. So in the role of the communicator, as we all know that the nurse is the person who will be providing care to the patient. So she will be the one who will be identifying if there's presence of any other symptoms or if there is presence of any other problems, and she can then communicate this either through verbally or through written form to the other healthcare teams. That is why the quality of nurses' communication is very important in the nursing care. The next function here is the teacher. So as a nurse, you can also be a teacher, whereby you will be the one who will be teaching the client on the various factors that they can promote their health and maintain it. If a person is healthy, you can teach them about the various healthcare procedures that they can adopt in order to restore their health. So, as a teacher, before the nurses teaches the client about anything, she must first assess the client's knowledge, learning needs, readiness to learn. Then only will she be setting some goals. After all of these has been assessed, she will then set some specific learning goals for the client. She will then enact various teaching strategies, and at the last, she will then evaluate or measure the client's learning. So, as a teacher, you can provide information and also help the client acquire new knowledge as well as technical skills. You can also encourage compliance with the prescribed therapy. You can also educate them about the various ways they can adopt in order to promote a healthy lifestyle. And the last one here is you can also interpret any information to the patient which they have a doubt on. The next one here is the client advocate. As we all know that the role of an advocate is to protect the client. So here as a nurse, you can also play a role of an advocate whereby you will be protecting the client as well as their rights. So in this role, you can be the one who will be expressing the client's feelings, thoughts, needs, and wishes to the other healthcare professionals. You can also assist the client in exercising their rights and also to help them speak up for themselves. The nursing advocate involves concern for and actions in behalf of the client in order to bring about a change. He or she will be the one who will be helping the client to promote what is best for them, and he or she will also be the one who will be ensuring that the client needs are met as well as protecting their rights. He or she can also provide explanation in the client's language, as well as he or she can also support the clients in their own decision making. So, being the client advocate is not easy. Here, you must have the necessary knowledge and you must have the guts to stand and speak out for their own needs. You must help them in their decision making skills, and also you must help them to voice out whatever they need and require. The next one here is the clinical and ethical decision maker. So what the nurse do here is that he or she will use the critical thinking skill throughout the nursing process and will make any decision in collaboration with the client as well as the family members. So as a clinical and ethical decision maker, this nurse will not only make decision in collaboration with the client and with the family members, but here she will also collaborate and she will also consult the other healthcare team professionals before they come to any conclusion. So as a counselor, the nurse will be the one who will be helping the client in order to recognize and cope up with various stressful psychological as well as social problems. So why do they do so? They do this in order to develop and in order to improve the international relationship as well as to enhance the client's personal growth. Not only that, but these counselors will also be the one who will be providing various emotional, intellectual, as well as psychological support. So why do we provide these coping mechanisms as well as why do we provide, various emotional psychological growth? We provide these because the main focus of the counselor is to help the client develop new attitudes, feelings, or behavior rather than just promoting their intellectual growth. The next one here is a change agent. So here the nurses will always act as a change agent when they are assisting others. So here when the nurses will be assisting the client, they will try to make modifications in their own behavior. So here the nurses often act to make changes in systems such as client care. As we all know that the nurse is the person who is responsible for providing care to the patient. So here as a change agent, the nurse can make modification in the care which she is providing to the patient if she feels like that is not helping him or her to recover from their disease condition. In the care, if the nurse feels that whatever care has been provided till date is not helping them to recover from their disease condition. The next one here is the leader. As we all know that a leader is a person who has a strong influence on others. He will be the one who will be setting various plans in order to accomplish a specific goal. So as a nurse, it is very important that she must have this leadership quality so that the patient as well as the family members could trust her and trust her decision making skills. Here, as a leader, they can be employed at different levels. It can be for an individual, for the family, for the whole community, or for a colleague. So, in order to become an effective leader, we must first understand the needs and goals that will motivate the people, and then the knowledge that which leadership should we apply in order to make this effective. And at last is the development of the interpersonal skills in order to influence others. The next one here is the manager. So as a nurse manager, it is the responsibility of this nurse to manage the care which is being provided to the individual, family, or the community. Not only that, but she is also the one who will be responsible for delegating the duties to the other staff workers and also to supervise and evaluate their performance. She will be the one who will be making decision, coordinate activities with others, as well as she is the one responsible for the allocating of resources. She will evaluate the care which is provided, and she's also responsible for planning, giving directions, as well as giving a fairly rewards and representing the nursing or the administration as needed. The next one is the case manager. So here from the name itself, you can understand that this person is responsible for managing the case of a particular individual. So here, this nurse manager will be the one who will be working with the multidisciplinary healthcare teams in order to find out that whether the plans which has been carried out in order to manage the case of an individual is effective or not. And the last one here is the research consumers. Here, as we all know that nurses often use the research in order to improve the quality of care which they are providing to the patient. In a clinical area, the nurses needs to have some awareness of the process as well as of the language of research. They should be sensitive to the issues which is related to protecting the rights of the human beings. They should also participate in identification of significant research problems. So these are the functions of a nurse. However, as the years are passing, there has been an expanded role of a nurse, and these are as follows. The first one here is the clinical specialist. This is a nurse who has completed a master degree in some specialty, who has had a considerable clinical expertise in that particular specialty. So she will be the one who will be providing the expertise care. She can also educate the other healthcare professionals. She can also act as a nurse consultant, and she can also participate in performing various research. The next one here is the nurse practitioner. So this nurse practitioner is the one who has completed either a certificate program or a master degree in a specialty. And she is also being certified by the appropriate specialty organization. She will be the one who will be skilled at the nursing assessment, who will be performing physical examination, and she can also be the one who will be providing counseling, teaching, as well as treatment. The next one here is the nurse midwife. So here it is a nurse who has completed a program on midwifery. Here she will be the one who will be responsible for providing prenatal as well as the postnatal care. She can also deliver babies to women who is not suffering from any complicated pregnancies. The next one here is the nurse anesthetist. So this nurse anesthetist is a nurse who has completed the course of study in any anesthesia school, and she will be the one who will be carrying out the preoperative status of the client. The next one here is the nurse educator. So this nurse educator is a nurse who has an advanced degree. So here she is also the one who has a good knowledge about the theoretical as well as the educational settings. So she will be the one who will be teaching the various theoretical knowledge, clinical skills, as well as she can be the one who can conduct research. So what is a nurse entrepreneur? Here, a nurse entrepreneur is a nurse who has an advanced degree and who will be the one who will be dealing with the health-related business. So each hospital always require this nurse entrepreneur. Why? Because she will be the one who will be handling all the business which is happening in the particular institution. The last one here is the nurse administrator. So, what do you think a nurse administrator is? Here, a nurse administrator is a nurse who will be functioning at the various levels of the management in the healthcare settings. She will be the one who will be responsible for management and administration of resources as well as personnel who is involved in providing care to the patient. So we have come to the end of this topic whereby in today's session we have discussed about the various functions of a nurse. A nurse has various functions to perform such as a caregiver, communicator, clinical and ethical decision maker, leader, client advocate and so on and so forth. So I hope you guys have understood this topic. Thank you.